Hi, I'm Glenn Pearson, and I'm happy to welcome you to the second video of my series based on the book Thriving in the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. I'm delighted that CRC Press published this book late last year as part of its HIMSS book series. And what I try to do in the book, and what I actually do in the book, is present 84 mistakes and pitfalls I've seen vendors fall into as they try to sell products and services to the healthcare industry, and I provide almost 200 suggestions on how to minimize those. So this is based on my 3+ decades as a senior healthcare executive, including more than 19 years as executive vice president at Georgia Hospital Association. And I also had the opportunity over the years to develop a number of healthcare technology related entrepreneurial products myself under the auspices of 2 different associations I worked at. And as I like to say, part of the reason I have such good ideas in this book is that I made a lot of these mistakes myself. So I'm passing them along to other people that are trying to be similarly successful. So what I'm doing is I'm sharing one video a week. There are 84 pitfalls. Don't know if I'll get through 84 weeks or not, but I'm starting with the ones that I think are the most relevant, that would be of interest to the audiences. So anyway, this is my second presentation. I'm doing this in random order, and this is actually pitfall number 45. And it's not offering a clear, demonstrable return on investment. And this is from the chapter that has several return on investment issues. So there's a traditional attitude within the clinical world that finances shouldn't matter. What really counts is what the patient needs are, and the money should be secondary. I did an administrative fellowship at the University of Michigan Health System right out of graduate school. And I remember one meeting we had where we were discussing a particular product line, and one of the older physicians seemed quite incensed that the subject of money even came up. He said, "I don't want to know what the status of my patients are in terms of who's paying for them, whether they have insurance or not, whether it's Medicare, Medicaid, private insurance, whatever, because what matters is what the patient needs." To a large extent, that attitude still prevails, but the realities of the financial world and healthcare in the last couple of decades means that the financial side comes to play much more than it might have in the past. And I have a couple of stories about that. One of my early clients was a clinician who had a product in what I would call a second or third tier clinical area. Not because it's not important, but it wasn't one of the major ones that health systems deal with. So it wasn't orthopedics, it wasn't oncology, it wasn't cardiology, things like that. And she had a product that was pretty good, but wasn't getting a lot of attention. And her comment to me was, I would have thought the clinical value of what I had to offer would carry the day. And I had to tell her that unfortunately that's not the case. And the story that I told that kind of illustrates that, I heard about a hospital CEO in a Midwestern city that had a inner city hospital built in the 50s, kind of dowdy, good quality care, but not a particularly attractive facility. And the CEO knew that there's a local arts community nearby, wanted to support the arts community, wanted to do some things to spruce up the building. So he ended up buying, I think, about $14,000 worth of original art from the local arts community. He figured it's a win-win because the arts community will like it, the community will see that they're part of the broader town community, and it would make the building look better. Well, unfortunately for him, the nurses did not see it that way. They hadn't gotten a pay raise in a couple of years, and they were all up in arms about how could we be wasting money on art when we're not taking care of our personnel. So that's one stress on the finances. You might have a senior surgeon ready to walk to go across town to the other hospital because the OR equipment's out of date. Maybe the roof just sprung a leak and has to be replaced. So there are any number of things competing for every available dollar that a CEO or a healthcare organization might be looking at. So just because you have a great product doesn't mean people are going to buy it unless you can demonstrate how it will pay for itself, at least cover the cost, and ideally bring in additional money as well. So I have 4 suggestions on how to develop ROIs, and of course I just have a few minutes here, so I'll just give you the high level. One is learn the ins and outs of how to present a credible ROI, something that senior executives are going to believe. Secondly, recognize that they are extremely skeptical about inflated promises that your product will pay for itself in a certain amount of time. Thirdly, don't overpromise revenue gains or cut expenses, because you're not going to be believed. Every vendor that comes in basically promises to do that, and every senior executive has seen that and is highly unlikely to believe that. And then the fourth point is seek merciless feedback about your return on investment projections. Go to people that are going to tell you the truth, whether your numbers seem to be credible and whether they think that you can be convincing for the right decision makers to be part of that. Hope this has been helpful. I will be doing these every week. Next week's topic is not realizing how hard it is to actually capture potential savings, and this is sort of a follow-on from this talk we just had today. So feel free to contact with me with some questions or comments. You can reach me at glenn@pearsonhti.com. That's GLENN, two N's, at Pearson, PEARSONHTI.com, or you can reach me through LinkedIn. So hope to see you next week to learn more about capturing savings.